Good morning. It's Thursday, August 27th, and we are here with the doctors in Ask Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. I'm here with Dr. Allison Arwady, your Commissioner for the Chicago Department of Public Health.
Good morning.
This is where you can get your questions answered about COVID-19 here in Chicago. Please submit your questions in the chat box below. You can also send them to us using the hashtag AskDrArwady through Facebook or Twitter. We are going to check our physical distance. Are we good?
Good.
We are good. Really important to keep that physical distance, to wear a face covering when you're out and about, because we're still working on stopping the spread of COVID-19 here in Chicago. It is up to us, and it's up to our individual choices that we make on a daily basis to keep ourselves and our loved ones, especially those in our household, healthy, and to keep each other healthy.
That's right.
So we're going to start, as we always do, with the latest data. Dr. Arwady?
Sounds good. So just as a reminder, you can go to chicago.gov/coronavirus to get to everything about COVID. We do continue to update that every single day, making sure our information is available in English and Spanish and many other languages, adding updates on the latest with contact tracing, putting in new guidance around restaurants, for example, like what the state released yesterday, and generally just trying to keep things up to date. So that should be your first stop if you're interested about things that are new related to COVID-19 in Chicago. The data piece, as a reminder, is up at the very top of that page. So you go to chicago.gov/coronavirus. Right up at the top, it says latest data, and then there's a lot of pull downs, and that's where you can get into all sorts of data. We really make this very available for people to download, to answer your own questions. You can see the hospital data, you can see what's happening with our movement data in Chicago, but the focus of it is really the dashboard. And so that's that first link there. You can also get there directly by going to chi.gov/COVID-. So if we do that and pull it up here, on the landing page here, this really highlights some of the numbers that we're watching the most. So first of all, you will note that our current positivity rate is up to 5.3%, and that is the test positivity rate. That is the way that the state calculates percent positivity, and we use to sort of compare regions across the state. And people may have seen this week, for example, that there have been 2 regions in Illinois that have now had restrictions imposed by the state for having a percent positivity more than 8% for multiple days. And while we remain down around the 5% range, I really, really want to get that back under 5%. We don't consider, it's not an emergency, but we are not in good control, in my opinion, where that is still over 5%, particularly because that's the test positivity rate. That's the number of positive tests divided by all the tests that are done, different from the person positivity rate. And the person positivity rate it's the number of positive tests divided by the number of people tested. So you only get counted once if you're a person getting tested. And so the positivity rate in terms of what we talk about publicly, what the state talks about, is about 5.3%. But our person positivity rate is over 7% now. It's 7.4%. And that person positivity is what we use to compare across zip codes, to look at different race ethnic groups, to look at ages, things like that, because it's the best way to really understand what's happening with individuals in Chicago. So either way, we're continuing to see that percent positivity trend up. Also, our case numbers are trending up, and you've heard me say that if there's one number that we are following, people ask me this a lot. What's the number one thing that you're interested in, that you're concerned about? And all along from the very beginning, it has been our number of new cases in Chicago every day. That is the one that you can't fudge it by sort of doing different testing patterns. You can't adjust it, and it is true new cases. So that number as of today is at 352 new cases per day on average. That's the highest we've been since, back sort of in our peak. And while it remains lower, certainly, than it was at the peak, we were seeing more than 1,000 cases a day on average. But being back up to 352 is concerning. you'll remember that we were under 200 new cases per day for a brief and shining moment there in sort of late June and early July. Not surprising that as we came out of the very strict shelter in place, we would see some increase, and I've been reassured that that increase has been gradual and has not hit our healthcare system. So our hospitals continue to be at sort of record lows from COVID, compared to since the major outbreak. But we're still admitting, on average, 13, 14 Chicago residents to the hospital with COVID every day. We are still seeing 3 Chicago residents die of COVID every day. And although that's way down from the 150 that were getting admitted to the hospital back in April, May, way down from the 50 people dying a day in May, almost, it's just not turning around in the way that we would like it to.
This is not the new normal that we want.
This is not the new normal. And the other thing people sometimes say is, isn't it just that you're testing more and that's why you're finding more cases? And I wish that that were true. It is true that we are testing more. So this middle number here, you can see we're testing on average 8,316 people every day right now. And that is pretty much just about the highest that we have done at any point. Let me blow this graph up and I'll show you. First, it's reminding you, just a week ago, we were just under 8,000 a day. We've seen a 4% rise in testing even just over the last week. And if we blow this up, you can see on the graph here, back in March, we were performing, 20 tests a day, 30 tests a day.
Wow.
By late March, we were up into the hundreds. And then by April, we were, 1,200, 1,300. And so, in some ways, that major peak in May, April, May, was also in the context of some significant under-testing as testing was just coming in. So it was even worse, right? All of this has been worse. But we are able to sort of correct for testing. We set this daily testing target, I'll remind you, of 4,500 tests per day. That means that if we're doing 4,500 tests a day, we are testing 5% of Chicago residents every month. We felt like that was a minimum number, regardless of what was happening up, down, all over the place, that we wanted to test to make sure, we were doing adequate testing. And that was a requirement back. We're doing a little throwback history here, but as we were coming out of stay at home, we had really set that as a requirement. And you can see, we started hitting that goal in May, and then except for a very brief dip in early June, which is when we were seeing really a lot of that first civil unrest and a lot of the violence and the looting, and we had a number of testing sites closed. Except for sort of a week period there, we've remained above that testing goal and have now long surpassed that, right? Now we're talking over 8,000 tests a day and rising. And that's good, but the concern is that that rising test number is accompanied by a higher percent positivity. And so if we were testing 8,000 people a day and finding 350 people and our test positivity was down to 2%, I'd be thrilled with that, because it would say, yeah, we're testing more and we're successfully keeping that percentage down, and we know that we're appropriately catching the COVID that's out there. But when we have a test positivity of over 5% and on the way up, and a person positivity of 7%, we know that in fact there are more people with COVID, even sort of day after day, that are not getting tested. And so unfortunately, although our testing numbers look good and our increase has been gradual, we are not making the right kind of progress here. And if we look just briefly at some of the demographics, we looked at this on Tuesday, but continuing really to especially see positive cases among Latinx Chicagoans and in neighborhoods that are predominantly Latinx. We are still seeing cases out of every zip code in Chicago, to be clear. We are testing in all areas. We are following up. Everybody gets contact traced. This remains a misperception I hear sometimes, that people think people are only getting case investigations and contact tracing if they live in a particular neighborhood. No, we have built up our capacity so that every case that we're receiving, CDPH works to initiate a case investigation and contact tracing. But if we look
and we've been very successful in reaching all of those cases.
Right? We've been
most of those cases.
We have a ways to go, I would say, in terms of still reaching everybody. We're doing a great job in terms of we've gotten our time frame down. So we reach out, as soon as the health department receives a case report, within 24 hours, we're reaching out to 90%, plus of the cases, which was the metric that we had set. The concern is that we don't reach everybody still. We have, when we don't reach people, we get the wrong phone number, for example, on the test report that comes in, or a number doesn't work, or we can't find people. And then if we do have the right phone number, we still have problems. People don't pick up the phone, or if they do answer, they don't want to engage. So we could have some more conversation about that. So I don't want to oversell that we are talking to everybody, but we have good systems in place where we are doing very quick outreach to every test that is reported to us for a Chicago resident quickly, and then quick contact tracing that follows on from that. If we look at some of what's happening really at a zip code level here, let me just hover over a couple of these and show you. So the Southwest here are the areas of the very biggest concern. 60632, you can see in the last week, actually had about a 15.8 positivity, and that is person positivity. So it's about twice the positivity of what we're seeing at the city average, and just below it here in 60629, a 14.8 positivity. So a lot of concern in the Southwest area. I'd say the Northwest too remains of a concern. 60639 is always a zip code we've been keeping close track of. They were at a 12.7%. So we have some work to do, and we have some work to do across the whole city. I don't want to, make the point, make it seem like it's only these areas of concern. But where we look at cases, let me just reset this real quick. Where we look at cases for the last week, that's what this graph is here. You can see down in the Southwest here are where we're seeing the most cases popping up. And so we are pushing resources there, but really working with a lot of community groups. Really would encourage everybody. We're having lots of ideas and lots of thought about how to get the word out. It's not that folks in these areas are sort of doing the wrong thing at all. In a lot of ways, they're actually doing a good job of getting testing, and we're having more success actually reaching people who are Spanish speakers in terms of people connecting with us, being willing to share contact tracing information than we are with non-Spanish speakers. But nevertheless, we just are seeing a lot of spread in these communities, and we are seeing spread across the whole city still, very much in these social and household gatherings. That's just what we're seeing. You look back a few months ago, we were seeing a lot of spread in workplaces. We were seeing a lot of spread in long-term cares, even in the jail, et cetera. This point, those congregate type settings are 5-6% of our cases, and 30+% of our cases are coming from sort of smaller household or like extended family type gatherings, and people
socializing between people who know each other.
They know each other. They feel comfortable. People aren't wearing masks or
and
keeping
we've always
distance.
kind of just seen that being out and about, right?
Yeah.
Seeing people gathered together in close
I know,
contact,
and it just worries me, because as the health department and as the city, we can better regulate public spaces, especially indoor public spaces, right? Like you saw that, or maybe, I don't know if people did see, but this week, at the state level, there was some more clarity on the requirement for mask wearing in restaurants. So we've already, for months, we've had a requirement, you have to have a mask on if you're in indoor spaces, including in restaurants. We got more specific here in Chicago, said you had to have the mask on at all times, that you were not seated, and just we've had a lot of conversation around masks, but took it another step forward and said, when you're interacting with your server, if you're at a restaurant, inside or outside, you need to have that mask on. And that's really to help protect servers who they did not choose to be in your bubble. Anybody you're eating with, when you have that mask off, you're within 6 feet, you have the potential to be spreading COVID there. But thinking about, work protections, et cetera, I thought that was a very good addition to the requirement around that. But anyway, we're all over the place in terms of talking, but I think this is just a lot of what the conversation has been, and want to emphasize we continue to know the things that work to help prevent COVID, and we need people to do those things even when you're gathering with people that you know and love.
Yeah. Yep. Okay, well, let's dig into the questions here. We have a few questions that are, is it safe to? And they're coming from Sharon Patterson and Maggie Harrison from Facebook. So, is it safe to visit inside homes at a safe distance?
Okay.
Do you want me to just read all three?
Sure, read them and we'll take them.
So, is it safe to hug when both people are correctly masked?
Okay.
And is it safe to have pro carpet cleaners or home cleaners come in to your home?
Okay. So the first thing I would say always is that there is no such thing as safe and not safe for COVID-19. Any interaction with a living, breathing human carries some potential risk.
Yeah.
And always there are multiple factors that come into answering an is it safe type question. Right. And so always the first thing, we've talked about this think twice idea. The first thing I want anybody thinking about is, am I at high risk for a severe outcome from COVID-19? Am I over 60? Do I have an underlying health condition? Or especially if both of those are true. And is there anybody in my bubble, in my household, or who I interact with without a mask within 6 feet who is also in that high risk group? And if you've got people who are in that high risk group, I really want you thinking twice and not doing as many things that would be of greater risk. You noticed I didn't say don't do anything, but people will have different priorities and different decision making, but I want you really thinking about that decision as you make it. And so then where we think about these activities and sort of how do they line up against risk. So all of these.
How risky is it to visit inside homes at a safe distance?
Yes, exactly. So we got inside homes, we got hugging with masks, and we've got pro carpet cleaners. So all three of these, first of all, are indoor versus outdoor activities. We like outdoor better than indoor. So there's a little bit of an increased risk for all three of these if they're happening indoors. And for example, if you're visiting a home or you're thinking about hugging someone, although that's the highest risk of these three, doing it outside would be preferable to doing it inside. Carpet cleaners have to be inside. So that would be one thing. Remember what the other questions we ask are, can you and everybody else always wear a mask? So for that question about can I see somebody inside a home, you're going to lower that risk if inside the home everybody's wearing the mask. And I would say if you're going to somebody's home and try to, and we think about can everybody wear a mask and can everybody keep that 6 foot distance. So if you're at a home and everybody can keep the 6 foot distance and everybody's wearing masks, that's a relatively low risk interaction. Mm-hmm. It is not a completely without risk interaction, but it is relatively low. So if we take them one at a time here, the carpet cleaners is very low risk. I am not high concern for people coming into homes to perform these kinds of tasks, whether you're fixing an appliance, whether you're getting something cleaned. Remember, again, as we've learned more about COVID, it's really that interaction with the living, breathing person that is the highest concern. So as long as you are able to be not in the same part of the house or even out of the house, when you've got someone in doing these kinds of activities, that is low risk. There's a little bit, again, small risk for the potential for COVID if someone were to be, coughing on things or touching them. Make sure anybody coming in, again, is wearing a mask. You would wear a mask, you'd be in the other part of the house. And then perhaps if you're particularly concerned, do some additional cleaning around high touch surfaces after you've had someone into your home. But that is really a low risk activity broadly as things go. Next in that risk would be the visiting people indoors. I think especially if you're willing to wear a mask and keep your distance, that is a pretty low risk activity. Again, think about who's in your bubble and who's there. If you're talking about being indoors without masks or without that 6 feet, that is where we are starting to see some real spread. And unless you've had a real conversation with that family about, are you going to be in each other's bubbles? Are you going to keep everybody else out and be very careful and do this? I would not encourage you right now with the amount of COVID that is in Chicago to just be broadly kind of entering and expanding your bubble in ways that don't need to be there. And about the question of hugging with masks. So hugging is very close contact. And I know this is one of the things that is absolutely the hardest for people to not be having this physical touch. This is where I really want you thinking, is this person going to be in my bubble? If these are people who live in your household, or perhaps you are, if you live alone, maybe you're expanding to, one other household that also lives alone or is smaller, or you're thinking about how to pull that together. Maybe you have 6 people, maybe you have 8 people, something like that, that are kind of in your bubble and you've had that discussion. You said, we're the group. We're the group that's going to get together and hug and interact and be careful about not bringing COVID in, especially if there's somebody who's a higher risk in that group. So we hear about grandparents, for example, who may have decided to interact with one family if they live closest, and otherwise they're not having, and that family is able to be really careful. Yeah. But I don't love that touch. It is a higher risk thing, even with the mask on. If you're going to do it, I'm glad to hear you're going to wear a mask. Keep your face apart, some of that. Notice you're not hearing me say don't do it, because everybody is going to make a decision depending on their circumstances and their decisions. Yeah. But it would be a higher risk activity. And if it's not somebody in your bubble, I would not. The carpet cleaning right now, I'm good with. The other two, unless you're really wearing the mask and keeping the 6 foot, if it's not someone you've already thought about having in the bubble, I probably wouldn't do it.
Yeah. Okay. That answer just goes to show you how much we really need to be thinking and processing as we're making these decisions.
Yeah.
Right?
Yeah. And the default decision, please, is to be careful, is to just be conservative. Our numbers are on the way up, particularly if you live in some of these neighborhoods that are higher risk, but even if you don't, it's a time. We're not under stay at home. We don't want to go back under stay at home. We'll do it if we have to, but we're trying to learn how to kind of live with COVID a little bit. Mm-hmm. And that means not having unnecessary opportunities for COVID to spread. COVID doesn't care. COVID doesn't care, how much you love this person, how much you want to do this activity, et cetera, et cetera. It's only looking for opportunities to spread. Mm-hmm. And people are going to make different decisions about what that risk is, but just be thoughtful about it and be conservative and do all the things that we know help limit risk. Wear that mask especially. It's just it's a very visual, important message too, I think, that says, I take your health seriously. And we want this to be in Chicago. We take each other's health seriously.
Yeah, and I think especially if you live with someone with an underlying condition or who's over 60, really, really important to think twice.
Yes.
And imagine that person being right there with you.
That's right. Because
when you go out.
They are. Yeah. We've talked a little bit about this sort of safe sex analogy that, there's this idea that when you have sex, you're having sex with all the people that they have had sex with if you're not using protection. And in some ways, that mask it's not fully protective, but it is somewhat protective there. But yeah, you are interacting with all the people that anybody. When you are interacting with someone, especially within 6 feet, especially without a mask, you are also interacting with all the people they've interacted with.
Yeah. Okay. Here's a question from @Julian Beckwith from Twitter. Would love to hear Dr. Arwoody's thoughts on the CDC now saying it's not necessary to test asymptomatic individuals.
All right. So, yeah. So earlier this week, there was a guidance change out of the CDC, let's say out of the federal government at least. There's some behind the scenes conversation about how much of this was sort of through HHS or the White House task force or through the CDC, but nevertheless, the guidance was changed. And we listened in to actually the call with the CDC and with the person from the White House task force who oversees testing to really explain what this was about. And what they said it was about was that they want to reflect better parts of the country that may be in good or better or less good control from COVID. And so on the call, they basically said, so we mostly want to defer to local or state health departments in terms of these recommendations. And so before even that call, just so you know, Chicago Department of Public Health, right away, that same morning, we put out guidance that said, we continue to see significant transmission here in Chicago. The Chicago Department of Public Health continues to recommend testing for asymptomatic contacts of anybody diagnosed with COVID-19. We also continue to recommend testing for people with high risk, or consider testing people with high risk exposures who have been in large gatherings, who have had other exposures, who have traveled to high risk settings. signs. And anybody who is asymptomatic, we recommend waiting to test for 5 to 9 days after the last potential exposure. So that's been our guidance all along, and we were very clear that that is locally still the recommendation. We also worked with all of the other Northern Illinois public health departments who echoed that same guidance. So across all of Northern Illinois, nothing has changed here in terms of the guidance. We continue to recommend the testing for symptomatic people and for asymptomatic people of concern, people who are living in very, high concerning neighborhoods. We absolutely want to get tested. Our percent positivity is going up. We already know we're missing people. I don't want to miss more people. I don't know, of course, what is going on with all of the politics behind this. I am a little concerned about conflicting messaging at the federal level. I think particularly as we are heading in toward the federal election season, there is a lot of desire to perhaps downplay the COVID ongoing issues that we have here. There's desire, everybody wants the economy going, but we need to sort of balance, obviously, sort of COVID risk against economy. And I think that what I really want to do with this, and what we are going to do with this here in the city of Chicago, is keep our messaging absolutely based on the science and what we know works and what is appropriate for our outbreak here in Chicago. And I want you to know that whenever this sort of guidance comes out, it is only guidance. Like, we can take or not take guidance and adapt it. We have the ability, and we have at both the both the local and the state level, put orders and requirements, and that is all. We can do that legally here. Yeah. It does not require a particular decision at the federal level. So please know that, I continue to very much trust the scientists at the CDC. They know what they're doing. We talk to them a lot. There's, I think, conversations that happen on the record and off the record, and we want to make sure that we continue to do the right thing, and we will continue to do the right thing here in Chicago and in Illinois to keep this outbreak under control. And heading into the winter, it may get worse before it gets better, and we will be serious about doing the things that we need to do to keep this as much in control as we can while balancing other things, and we'll do that based on science. So those are my thoughts, and whenever there is any federal statements that come out that we perhaps are not fully in agreement with, we are very quick to share if we have a different recommendation and why. And that federal guidance did specifically carve out that, basically the exemption to this is if your local or state health department recommends otherwise, which we have.
We have jurisdiction.
We have jurisdiction here.
Okay, so here's a follow-up question from Ina Miller from Facebook. Just saying we need to be able to test asymptomatic individuals for successful contact tracing.
Yes.
Would that be correct? Is that true?
Yeah, so a couple things on that. So first of all, we need to be able to test asymptomatic people for a number of reasons, but the idea is that, maybe this isn't exactly what she asked, but I want to highlight this too, that someone who is a known contact, like a real contact, a household contact, a within 6 feet for 15 minutes contact to a confirmed case of COVID, must quarantine for 14 days, regardless of test result. You cannot test your way out of quarantine. And so we recommend waiting that 5 to 9 days, because again, if you test right away, like if if I got exposed to COVID today and I went and got tested, my test would be negative today, it would be negative tomorrow, it would probably be negative for a number of days until the virus builds up to a point where you can detect it or where I potentially develop symptoms. But we do think that it's, so on the one hand, if you know you've successfully gotten all of your contacts and they have all successfully quarantined, it is what it is. But we think it's important to test, because if the contacts have gone on to get COVID, did they have additional contacts?
Right.
And you need to make sure, you're monitoring for symptoms, et cetera. So the top priority still is anybody with symptoms, right? Even mild symptoms. You must stay home except to get medical care or testing. It has been the law since before stay-at-home order. I can't emphasize enough how important that is. And anybody who is symptomatic is our top priority for testing. But right behind that are asymptomatic contacts of confirmed cases. And it helps, every time a case is detected, whether or not they have symptoms, we do a full case investigation and a full contact tracing, because we know people without people without symptoms are able to spread COVID. It's what has made this outbreak so hard and so different from virtually every other outbreak. SARS, MERS, you're doing a flu outbreak, you're doing a measles outbreak. People have symptoms and then they're spreading. This fact that we have a lot of people spreading before they get symptoms and some people not getting symptoms at all is the number one reason, in my opinion, why we have seen the kind of spread that we've seen, because the traditional public health containment just kind of can't work as much. And that's the other reason why the mask became so important once we realized that was a major portion.
Yeah. I think it's important to restate, you cannot get a get out of quarantine free pass with a test.
You cannot. And although the requirement for quarantine is around people with an exposure to a confirmed case, we also do, if you have had, for example, what's another requirement for quarantine right now? People returning from a state with a high incidence. You got to quarantine for 14 days. You can't test yourself out there either. If you've been in a significant gathering, there's been some concern, we really want you quarantining ideally and not thinking about sort of testing your way out of there. So we've not seen significant spread attached to protests, for example. I think some of that is because they've been outside and people have broadly been doing actually a good job of masking and trying to keep that distance. We have seen some cases associated with it, but we've not seen big spread. And we've done testing actually around some of the protests to actually sort of understand that, have offered that, and that's been true nationally as well, which is good. But those are higher risk settings, and my recommendation all along has been, if you can't exactly quarantine after a medium risk here, at least quarantine yourself from anybody who's high risk. Do not be getting up close and personal with someone who is over 60, who has those underlying conditions for 14 days after anything you're even a little bit concerned about related to COVID exposure. And if it's been a real exposure, you got to quarantine regardless of testing.
Got it. Okay, Martin Smith from Facebook. What is the city doing for HIV during COVID?
Good question. So we have a large HIV program here in Chicago. We get a lot of federal money actually, and are responsible for making sure people who have HIV have lots of needs met, making sure that they're getting drugs, but also making sure that they're getting care and they're getting housing needs met, and they're getting just a lot of support from both an individual support perspective and a infection control perspective, honestly. And so, last year we did some really important reorganization, I think, of all of our HIV services. And we work with a lot of community partners and healthcare partners. We, for example, are required to use this federal money to pay for the clinical care of folks with HIV. But we work to pull people into what are called medical homes so that anybody with HIV is able to sort of have one place where needs are being met, and then we can coordinate housing needs and social needs and all of these in a much more one-stop coordinated method. And I will tell you, that kind of work that we did around HIV, it was a really different paradigm for us. It's been so helpful as we've thought about COVID, because COVID, people being diagnosed with COVID, right? They also often have a lot of needs. We're having quarantine requirements. What are we doing for food? What are we doing for housing? Quarantine, do they need Q&I housing? Do they need what are they needing to be able to get appropriate medical care, get appropriate testing? That, I think a lot of
affects everything.
It really does. So a lot of that really important reorganization work for HIV was so lucky, I think, frankly, that we had done that. And so, for example, we've got this HIV Resource Coordination Hub now, which is this one-of-a-kind program. It's a single stop for anybody with HIV. And during the time of COVID, it's been especially important to make sure that we can get folks connected to mental health resources, to substance use resources, to all of the other basic things. And we've been able to sort of stand that up, and then we're modeling our COVID resource hub, right, which we're going to be standing up in a community-based way, is actually in a lot of ways modeled on that work we did with HIV. We also got some additional federal funding. So we've been able to meet emergency needs for people with HIV. So just during COVID, I was just reading this, like just since March, I think we've fulfilled like 750 emergency requirements for folks who are living with or vulnerable to HIV. Everything from additional housing needs to like internet access needs, where that's become really essential. Food needs, utility needs, like COVID has hit folks living with HIV who would be considered in a more vulnerable group, like particularly hard. And so we've been able to meet a lot of those needs, hundreds of thousands of dollars to do that. And there's a new program that we're funding, this hotel to home concept, which I'll remind you with for people who are experiencing homelessness in Chicago, one of the things I'm really proud of that we did very fast and early here was what we called shielded housing. So people who were living in shelters actually, and they were in that higher risk category, if they were over 50, had underlying conditions, moved them into some of our quarantine and isolation hotels, not waiting for them to get COVID, but sort of shielding them, and then have managed to get them mental health supports and substance use, and have partnered with some amazing partners in the clinical space here around Chicago, and actually have now worked to move many of those people into permanent supportive housing. And we're just getting the last folks sort of housed like in these last couple weeks. But on the HIV side, they replicated that with this hotel to home idea where people, again, with HIV or very vulnerable to HIV, you really want to make sure they're getting housing and shielded housing right now. You don't want folks in these congregate settings. And so moving people into a hotel, funding that, and then having that be a little bit of a bridge space for making sure people are kind of stabilizing and getting needs met while we work on permanent supportive housing. And then got some additional funding also to expand the housing options for people living with HIV. And there's been stuff like making sure telehealth, working with our people who provide HIV care, that people were well set up. That's where the internet access comes in. Thinking about things like making sure the drug supply didn't get interrupted for folks with HIV. So the team, has worked extremely hard at the health department. They always do, but the HIV team, I think, has been just central to thinking about folks vulnerable and with HIV in Chicago, but also doing this like whole person work, which I think is just such an important thing. It's not done very well in the healthcare system all the time. And we've been thinking about how to take that model and move it into COVID. So anyway, that was a long answer, but it's I think it's been a particularly good area in terms of the work here. So
yeah. Okay. Pamela Straitman from Facebook. Are there plans to have outdoor flu shot clinics?
Okay, great question. So we are actually experimenting with all different models of delivering flu shots here in Chicago. As a quick reminder, you can start getting your flu shot now. They're just coming in. You can go to chicagoflushots.org if you want to see pharmacies that have it available. The health department will be standing up various clinics. And we're thinking about the potential for sort of outdoors, or even like, because much of our flu work happens in colder season, and we're expecting our COVID vaccine to probably be, unfortunately, at least get started, probably in like the heart of the winter. And so while we are thinking about outside, we are also wanting to kind of take some lessons learned from our flu campaign and apply them to the COVID vaccine campaign that is likely coming. So we're thinking about things, both models where, how there's drive-up testing, where you can swab people's noses, or at the city sites, we do these mouth swabs. We're thinking about actual sort of immunization models in cars, like drive-through immunization, either where people stay in their car, or perhaps they're still in the drive, we pull them out of their car on an individual basis. You can't really, kids would be squirmy, for example. But we're thinking about sort of some of those models, thinking ahead towards COVID. We're also thinking about using more of a registration system. So it's not going to be a like, come one, come all, show up. We obviously have to make sure the social distancing is in place. So we're putting some new kind of scheduling in, and we're even trying out some of our tech systems. We don't want to be on paper, ideally. We're really trying to use the flu season to practice the ways in which we may do the COVID vaccine. So it's possible that you could see a flu vaccine outdoor type clinic, or perhaps an experimentation with some of these models. But mostly we just want people to get their flu shot. And so that means going to your doctor, doing your preventive check that you might otherwise do through your physician, through your pediatrician, through your nurse practitioner, whomever, starting to get flu shots in there. Go to your pharmacy. It is not too soon, and everybody basically over the age of 6 months, with a very few exceptions, should get a flu shot every year, and especially this year. So please start doing that right now. And in most cases, it is, almost all cases, it's free.
Right?
Yeah, it's free. It's covered by insurance. There's not co-pays. Often the pharmacies will even give you like a $5 coupon to use in the pharmacy if you get it done there. Certainly any clinic that the health department stands up is entirely free of charge and does not require insurance.
Okay, good to know. And it's time to get going on
Time
that.
to get going on that.
Okay, there's a question here that I think is really important, and I think there's a quick answer. So I'm going to do this last question from Kelly Brown, Facebook. How are people supposed to report businesses? If we call the cops, they laugh and say enforcement is not on them. Health department is closed at nights and weekends.
That's right. Okay, so very good question. And the answer is 311. If people are not familiar with 311, it is how you both request city services and report non-emergent problems within the city. So you can call 311. That can be from your cell phone, regardless of what your cell phone's area code is. It will dial you to the Chicago 311. But also, if you don't want to wait on the phone, there is an online version of this. There is an app version of this. You go to 311.chicago.gov and you will see, you just put in a resource request. There's a COVID-19 button even. And if you just put in, you can just free text your concern or your question. And that goes directly to either, depending on what the issue is, sometimes it comes to the health department, sometimes it goes to the business affairs and consumer protection. It could be police involved, I suppose, depending what it is. But for businesses, that's where it's going. So please, if you see places not doing the right thing, not having masks appropriately, being too crowded, anything you're concerned about, we 100% want to know about that because we are enforcing big time. You hear us really every week, we're talking about businesses that are getting shut down if they are not following COVID precautions. So that's your easy way to do it. Call 311 or go and put in a service request, and that gets to us. And that's how you can always get in touch with the city when you have things to let us know.
Yep, the city is responding to those reports.
Yeah.
Okay. Do you have any good news for us, Doctor?
We do. Let's see. So, okay, a couple things. One is that if you know a young person between the ages of 14 and 19 who's really excited about their community and Chicago, we're looking for young leaders to actually join the Mayor's Youth Commission, which helps advise the mayor and the city on all things related to youth. If youth commissioners are selected, it's a 2-year term, and you have to attend monthly meetings, which right now are virtual. So applications need to come in no later than August 31st, and you can check online on the city's webpage, but otherwise if you go to tinyurl.com/Chi Youth Commission or Google Chicago Youth Commission. So if you know a young person, it's a really nice opportunity to get involved at the city. And the other thing I wanted to just let folks know is that we are launching our Healthy Chicago 2025 plan. We were meant to launch this back in April, I believe, and we were a little bit otherwise occupied back in April. But this is the 5-year plan for the city, and it is focused on not just sort of improving health in Chicago, but it is very focused on the racial life expectancy gaps here in Chicago. And it's all about both what are the drivers of that in terms of chronic disease and other things where there are big differences in terms of deaths, but it's also very much about the root causes of this and what are we doing, not just the health department, not just the city of Chicago, but all Chicagoans to really think about health in this holistic way. So on September 17th from 2:30 to 4 will be our virtual launch. You're all invited. But in the meantime, please do post. If you're watching this, that means you are at least somewhat connected to Facebook or Twitter. And we would love to have you post with the hashtag #ONE Healthy Chai. So One Healthy Chai. Let us know what Healthy Chicago looks like to you. So you basically want to post like hashtag One Healthy Chai means affordable housing, means quality healthcare, means whatever it means. Post what it means to you. Even better, if you post a picture, we will use these in the launch. We really want to kind of highlight what Healthy Chicago means across the city. So please take a minute, let us know what it means to you, think big, and post your pictures. And more to come on that, but that's an exciting thing that's coming. That's my good news. We will be back this coming Tuesday.
Any special guests?
Do we have a special? Who is it? Oh, yes, we have a very special guest. Thank you. I was getting a reminder off screen there. So Dr. Novak is going to be our special guest. He is the lead of the first phase 3 vaccine trial.
Wow.
So from University of Illinois at Chicago, who's going to be talking in detail about the vaccine trial here in Chicago. We'll be able to answer lots of questions that you may have about vaccines, how you can get involved. So yeah, we're really excited that he's coming. So that'll be next Tuesday at 11 a.m. with me. And in the meantime, we are continuing to answer your one-off questions and posting these. So keep sending those in. We follow them, we collect them, even if it's while we're not doing the live Facebook. And maybe the last thing I'll mention is that next week, also in the evenings, are going to be the budget town halls. So pay attention to the mayor's social media page on this. But if you're interested in learning more about the budget of Chicago, each evening there's going to be a different focus in terms of the budget and some of the departments and how funding is really spent here. So a good way, they'll all be virtual. So you can tune in and learn some more about sort of how the city works. So
there'll be lots of opportunities to give your feedback about how you want the city to use its resources.
Yeah, and they're doing it actually as a Facebook Live platform. So similar to this, so there will be some opportunity to put in questions. So keep your eyes open for that. Really, I think it's happening Monday through Thursday next week. So.
All right. So yeah, we just want to remind people to think twice.
Yep.
Reduce your risk.
Reduce your risk. Do the things that you know work. We want to get those numbers down.
We got a new curve to bend.
We got a new curve to bend. It's relatively flat, but we really, especially in August, this is the time to be getting it down, not up. But with that, we'll see you back next week, and be safe, Chicago.